ndingomnye wabo osaziyo esi sibhedlela uba saqala kunjani. Kwakungathi yifama. Kule 30 years isibhedlela sikhona, ngelakhi okokutsho okunye futhi, njengoba esi sibhedlela silapha ngoku, isoyi lazothenishwa ngu-MEC Gqobane. Then mna Mama Gadla, I was a member phaya eTaylor Bequest Hospital. The chairperson ngelo xesha yayingu-Mr. Lisawana from Taylor Bequest Hospital. So ndifuna ukuthi kule 30 years sifumene ntoni? Kule 30 years inkululeko ikhona eMatatiele, kuba kaloku abantu babebaleka xa kuthiwa santa abone ukuthi umuntu yho, uba ndingaxelela umakhelwane uba ndine-TB andisokuze ndi-expose. Ngoku thina singu-hospital board wase-Khotsong siyakhampeyina, kuba kaloku niyayazi into yoba kukhona le nto ye-cross border. Kukhona abantu abasuka from Lesotho bezongena eMatatiele. Siyabazingela kawuba ndenzela uba bangazuthelela abantu balapha eMatatiele. Ndingathi okokutsho nje mna ndingu-board member, siphatheke kakuhle kakhulu, sibambisene nesibhedlela sase-Khotsong. Yonke into intle, and siyayazi into okokuba esi sibhedlela kaloku kusuka abantu abasuka from Montfrey, Mthatha, Mount Alief, even the Kokstad, they do come kwesi sibhedlela, kuba kaloku esi sibhedlela is a special hospital.
I am Alfred Nzo, the Chief Executive Officer for Khotsong TB Hospital. Today we are here in celebration of the 30 years, 3 decades of freedom in South Africa. This hospital is a TB hospital that caters for more than 900,000 population, which is the population which is around the Alfred Nzo District. But beyond that, we also cater for other districts like Jogabi, OR Tambo, and a small portion of KZN population. This is a hospital that has about a total of 120 beds. From the 120 beds, there are 44 beds for drug-resistant TB, and there are 76 which are for drug-sensitive TB. So from the 44, we have 40 for adults and 4 for pediatrics in the drug-resistant. And from the 76, we have 16 pediatrics for DSTB. We have 30 for both male and female, meaning that 30 each. So as we are here today, we are very much proud, you know, to be celebrating the 3 decades of freedom, because we are coming from far as a hospital, and also the community of this district. It's coming from far, because if I may just go a little bit backwards, this hospital initially it was a barracks for the soldiers as SANDF, and for more than, if I'm not mistaken, for more than 6 decades. So after that, it was taken over by what we used to call the NGO called Santa, that was assisting in terms of management of TB, working with government. And then later, as we progressed, after the freedom, around 2005, it was taken over by the Department of Health, to be under the Department of Health. So many people, they used to know it as Santa, and even now they're still calling it Santa. But after it was taken by the government, it was named Khotsong Santa TB Hospital, meaning that this is the place of peace. That's why it was named Khotsong. So that's what I can say about the history of this institution. Then this new infrastructure, it was built, the program started around 2014 and it was completed in 2023 and it was opened officially and handed over by our previous MEC, Honorable MEC Math, who officially opened it in August 2023. So really, as the CEO of this institution, I feel proud, you know, and to be where I am now, because the government has done a lot. Looking at the strides of government and trying to improve the health of the marginalized. Eastern Cape, it's one of the provinces that is very rural. West Alfred Nzo, which is one of the most impoverished districts. So it's among those districts that are known in the country that it is poor. So even the patients around and also the communities, they are so happy and thrilled to see themselves having to be admitted and sleeping in an environment like this. Because the environment is very important for their healing. Yes, we know that clinically we have a lot of contribution, but clinical also goes along with the environment that people are in. So that's what I can say around about the institution itself or the infrastructure. As we can see that this is one of the most beautiful infrastructures. You can go around, look, compare with private institutions. We know and we are proud because this is one of the institutions that is tops. It's even beyond a private hospital. Even the services that are being rendered here, the staff are rendering them with love, with care, you know, with compassion. They are very much passionate about their job. They are very generous. Even the patients, they are always happy. I'm happy to say that, and proud to say that we rarely get even complaints because the services that are being rendered to the clients, they are tops, if I may put it like that. Then also to say that I think I'll be doing a mistake if I wouldn't really commend the government for the work that they have done, you know, in terms of prioritizing Alfred Nzo District in relation to building an infrastructure like this. Like I've said prior, that most of the people that are here, one of those who have been marginalized for years. It's not even it's not even few decades, but if you look back, it has been for years. So this is something big and good, and it's something that really makes the people here to see that they are prioritized. And looking at the strides and also the plans, the goals of the department, because we are moving towards the national health insurance. And one of the things that the department is striving towards is to make sure that the infrastructures are revitalized, the quality of care is improved. So for us, we can see that we are moving towards there, and we are even ready for the rollout of the national health insurance. I'm saying that without any doubt, because we have almost everything, the state of the art equipment in this institution. So we feel that we are very much honored, you know. Even myself as the Chief Executive Officer, I feel good and I feel great. I feel honored to have been placed in a place like this one, because at the end I know that besides taking care of the employees, you know, wellness, even the people that we are here for, they are being put or managed in a well and a good environment. So that's what I can mostly say around the progress and also how we feel about it. And yeah, I will reiterate that definitely we are ready for the national health insurance, and we are working very hard to make sure that the people that are entering that gate, they enter sick but still alive, and we try as much as we can to make sure that they go outside the gate being alive. Yes, we do have deaths, but they are very few, which may be most of the time it's because they are coming very late, they default treatment.
Kulo mcimbi we-challenges ebesinazo kulesibhedlela esidala. First, it was the infrastructure yethu. As we all know, the infrastructure yethu was not up to a standard, but we were working quite well in such a way that our hospital was the cleanest within the region. It was voted to be the cleanest, although we had an old infrastructure. But with regard to the challenges, there were few, if I can say the one that I was aware of. There were not much. It was with regard to staff, the staffing that we had. We had a few, like for instance, we didn't have an X-ray. Officially now in our new institution, we have an X-ray, which is working quite well. And we also, there was no good infrastructure when it comes to basically in our individual that were helping us. Like instead for one of all was a physiotherapist. We didn't have a physiotherapist, and also we didn't have a social worker. But as we continued and we moving to this new infrastructure, we were able to get abantu abafana njengo-physio nododuzana nabo o-social worker ukuthi bafike bezosincedisa apha esibhedleleni esisha. Yes. Yeah, there were few, there were not much. Although when it comes to infrastructure, infrastructure it was not up to standard. Yes, but it was maintained quite well. It was the cleanest. Yes. Oh, when it comes to that part of accommodation, accommodation on the old institution, it was good and clean. Although on the accommodation part, we had to, in case of we didn't have the showers within our rooms. We had to, but the hospital was able to get us some whereby we are trying to park home, a park home where we were getting our showers and everything. And also when it comes to infrastructure on this new institution, now we have indoor showers, indoor kitchen, but on the old institution, our kitchen, it was a one room. The whole thing was in one kitchen, bedroom and everything. Umuntu ngoku unekitchen lakhe izinto kakuhle tata ikuhle nje impela. Hey,
grocery yakho
yonke ihleli kakuhle nje, igrocer ihleli kakuhle, kunama built-in wardrobes and built-in cupboard, kitchen. Yonke indawo nje kuhle nje kakhulu izindlu zethu.
So i-bachelor flat nyana nje e-Brand.
Kakuhle nje, we are very happy nje, siyabonga kakhulu kwi-province kakhulu ukuthi isinikeze lokhuzana leya noticement ukuthi isigcine kakuhle, siphathe kakuhle as abasebenzi, because that's where you spend most of your time as a worker.
Yeah.
Even after work, most when you go to a room which is healthy and that's where you rest, and when you rest you
Yes. Azinkokheli yabasebenzi ntoni mhlawumbe onotisileyo kwi-moral yabasebenzi now that nale facility inje?
So with regard to our moral now is very good and positive, and also we are working productively now, because now we see most the demand with the infrastructure. It demands us to provide the best now, because we're one of the beautiful hospital within the province, and also now we are committed to also improve and provide the best services within our region.
I'll be taking you through the hospital and showing you around in each and every department, following the patient flow. Okay, we are in admissions now. This is where the patients that are coming for the first time that are being registered, they will come here and they will register their names here. Then they will be taken to OPD if they are the new clients, and they'll be assessed in the OPD. If they need any admission or a certain service, they'll be taken to that certain area, then they'll be admitted to our wards. So I'll be taking you through to all those sections so that you can see for yourselves. This is our laboratory service for the hospital. It's the center where you send your specimen to be tested and everything, then you get your results. This is meant for the hospital. Okay. As I said, depending on what was being assessed by the nurses in OPD, you come to radiology services. If the patient again warrants to be assessed or to be X-rayed, then the patient will be transferred here to our radiology service. This is our radiology service. It's the state-of-the-art X-ray department. This is our X-ray department. This is the waiting area. The patient will be waiting here, and then full names and all the credentials will be written there. Then the radiographer is here. Okay, this is our X-ray department. Okay, this is our X-ray department. This is the machine where we do X-rays, X-ray images. This is our X-ray. This is a very expensive one. I don't even think there's a hospital around here that is having this machine. It's a very expensive one. This is where we do our X-rays and everything. That's a changing room. You change there, then you come here, then you're being X-rayed, then whatever that is being done, then once you finish, then you go back to the ward. Okay, this is a monitor, and the X-ray person will just stand here and see it from there. This is an administrative rehabilitation center. In the rehab, there is a physio, your social worker, a dietitian, and OT. They are stationed here. So our patients, they are coming from the wards and also from OPD and transferred to here if they need that service, and they are going to be assisted here if they need that service. So this is the reception where they are being screened and the information is being taken and so forth. Then they are referred to that particular section. For instance, if the patient needs dietetics assessment and so forth, then the patient will come here. If the person wants audio assessment, then the person will come here. Then this is the physio office for the physio. This is the physio office. But then, if the patient needs the assistance in terms of physio and so forth, will be taken to this side. Okay. This is our exercise room, the physio gym. As you can see, this is where it is, where the physio is working with the patients. And this is the sort of an exercise area for the patient outside here.
This hospital is a very beautiful structure. But what is interesting about this hospital, this used to be an army camp. The soldiers stayed here, and there was a wall that separated the community which was then known as Butterfly, with the army camp. But to my surprise, this wall was removed. And now that it becomes a hospital that treats people who suffer from tuberculosis, or TB as we say it, it's a concern for me as the leader of the community, as well as an individual, that that wall was removed. And the question still remains, why was that wall removed? Because it is definitely one of the buffers that will also prevent the spread of the disease. Whether we like it or not, tuberculosis can be contagious. It can be contagious, and when it becomes contagious, it means that other people who come in contact with you can also get sick. But I must commend the Department of Health that they considered to improve the structure. This is a wonderful, a beautiful structure, and I'm sure even the treatment in this place has improved considerably. We are very grateful that we have qualified people. We even have more doctors. If I can remember a couple of years back, the doctor used to come from the Taylor Bequest Hospital and would come here and treat patients for an hour and go back. Now we have resident doctors here. We have a resident pharmacist. We have resident nurses. And the number of staff members have increased. You can even see the floors of this place is beautiful. It means it is kept clean. So there is a lot of attention given to cleanliness. And remember, when you are sick and the place is clean, you will get better. And I really want to commend you for doing this, because in future, many people don't know what is happening at this place. Many people have never seen Santa Hospital improved like this. Some of them who are old still remember the old building, the old army barracks. They don't know this new building. Even for me too, I haven't really gone through the whole building, but I can see there is a lot of improvement here. Even big windows and beautiful doors. And there's even demarcated parking for our vehicles. So I want to thank you very much.